Alberta's Premier Danielle Smith addressing Alberta's struggling hospital system for the first time since a father died in an Edmonton emergency room while waiting for care. In an interview with City News this weekend, while the Premier is promising action, doctors inside the province's ERs don't buy the explanation.
We've had our emergency rooms for many, many years, where instead of admitting a patient into a medicine bed, they're sitting in a treatment bed in an ER. And when that happens, it means that there's no beds for new patients coming in to be seen and treated.
Premier Danielle Smith acknowledging the tragic death of a 44-year-old Edmonton father in late December last year. He died of a heart attack after waiting 8 hours to see a doctor at the Grey Nuns Hospital. Speaking with City News at the Federal Conservative Convention in Calgary this past weekend, Premier Smith says the issue is that patients like seniors requiring long-term alternative care are taking up hospital beds. Putting out this video Monday saying work is being done to create space, while also laying the blame with provincial healthcare provider Alberta Health Services.
When we left it to the experts, AHS, they continued to have crowded emergency rooms, but they would also allow people to live in hospital. We found 8 people who were living in hospital for 1,000 days or more.
This government has a report that's been sitting on minister's desk that they paid consultants a lot of money to tell them this was a massive issue. They've had it for months, if not longer.
But doctors working inside the province's emergency rooms say this shows the government has known this is an issue for a long time.
It has nothing to do with Alberta Health Services. As one example, the death that occurred that was very tragic happened at the Grey Nuns, which is Covenant Health. AHS is dead. The Premier has killed it. It just runs some hospitals now. The Premier is taking over 100% control of the Alberta healthcare system, has made a whole bunch of bureaucrats, has taken 4 ministers. She owns everything now. So for her to deflect this to anybody else is just nonsense.
Alberta's opposition, meanwhile, creating a petition to call a state of emergency in Alberta's hospitals.
Declare a state of emergency for our hospitals and emergency rooms. Install a central command for decision-making so that workers can navigate the chaos created by the UCP and its 11 new health agencies. And recall the legislature early. We're running out of time to do that because we're coming back soon anyway, but we should recall the legislature early to hold an emergency debate on health care, so that this government can answer to the legislature.
Alberta's Ministry of Assisted Living telling City News they are working to build 1,800 new spaces for seniors. The Premier says she'll be meeting with public health heads over the situation to judge how Alberta's hospitals are performing. Darcy Ropchan, City News, Edmonton.